Hello, my name is Melissa Daniels and I have strabismus. Strabismus is when your eyes are not pointing straight and not working together. Now on this channel I give lots of solutions and ideas for working through this issue and getting your brain and eyes to the point where they can work together. I was born with this condition, but there are many people who don't experience strabismus until after they have had a traumatic brain injury. And today I'm going to go into different cases of when and why that happens. And then in the next video, we are going to talk about some different solutions for overcoming that. Before we jump into that, be sure to go over to learn.strabismussolutions.com or just scan this QR code. Over there, you can get a lot of different resources that I offer. My course, you can sign up for a Zoom call with me, take the quiz, download a PDF exercise. There's just a lot of different options, so be sure to check that out. There is a huge variety of different types of traumatic brain injuries. It could be something as simple as your child falling off a chair and hitting their head on the floor, or it could be a car accident or getting hit in the face with a baseball. There's just a lot of different things, even a stroke or a brain surgery, those different things. There's a lot of different types of brain injury. And so each of them can cause, sometimes they cause strabismus, sometimes they don't. It can vary, and they do for different reasons. So I'm going to try to go into each of these different scenarios and explain why strabismus may occur after them. And then in the next video, I'm going to talk a little bit more about solutions as far as surgery and vision therapy and different types of glasses and other types of like physical therapy, just different things that you can do as somebody with a traumatic brain injury who is experiencing strabismus, and some different solutions. So that'll be next week. The first and probably most common reason that strabismus starts after a brain injury is from a nerve palsy. So your eye muscles are controlled by three different nerves. You've got the cranial nerves, like the third, fourth, and sixth are all controlling these eye muscles. And so if one of those nerves gets injured, whether it gets pinched or damaged in a huge variety of ways, that's going to stop the brain from being able to control those movements. So a lot of times you might be able to look straight forward, but as soon as you try to move your eye over, one of them goes really far up or turns really far in, just different things depending on which nerve it is. So these types of strabismus are usually, what happens is the person has single vision in 2/3 of their world, and then really severe double vision in any gaze where they're trying to move their eyes in a way that the muscles are not able to move in one of the eyes, and so then they get really severe double vision. A lot of times they'll start developing like a head turn or body tilt, different things that help them manage that double vision and keep their head in a posture where they don't have to move their eyes in that way. Because if the nerve is damaged on one side, and I don't know what, I'm not an anatomist, I don't know what that word is, but if it's only damaged on one eye and you try to look to the right and that muscle's not working, then this eye looks and this eye goes somewhere else. Another example would be more mild if somebody maybe just got hit in the head and they had a concussion and they start getting a little double vision, but their eyes still look straight. Many times this will happen. The eyes appear straight, but they're not exactly aligned anymore, and it's making it really hard to give single vision. So a lot of times this will happen that maybe somebody had what they would call aphoria, and aphoria, like an esophoria or an exophoria. So an esophoria is like your eyes are straight, but your brain wants to just bring them in. Like that's more comfy, but you fight that. And you kind of are putting in a little bit of extra effort to keep those eyes straight. And then you have this head injury, and all of a sudden you kind of lose that control. And it's like, I can't do it anymore. I'm tired. And it can change from an esophoria to an esotropia. Same thing can happen with exophoria. Maybe they had like a mild convergence insufficiency before, get hit in the head, and it's like they just lose that control because their brain is in this healing process and it just can't anymore. So if there was a minor problem before, it's going to exacerbate it and make it worse after you have this head injury. And it can also take somebody who had perfect vision and they get that esophoria or exophoria where now their brain has to work really hard to keep things single, and so they're maybe seeing some double while they read, or double in the distance, something like that. That's pretty common with a head injury. Some people, it is like that for a few weeks and then it goes away, and some people it just never goes away until they address the problem with vision therapy. There's other types of trauma where muscles can actually be damaged, not necessarily the nerves, but you get hit right in the eye and that breaks the bone and maybe tears a muscle. I don't even know. Like, it all just makes me want to pass out to think about it. But that's like a muscle is damaged, and then that muscle can't work anymore. And again, it's going to create a strabismus where the eyes are not aligned. A last example is just kind of a general idea that there's certain lobes of the brain, like the occipital lobe or the parietal lobe, these lobes that are so involved with vision. I mean, 80% of the brain is involved with vision. So when the brain gets hit anywhere, that's going to affect vision, and it can affect it in different ways. Sometimes it's going to affect your visual perception. So being able to see something, understand what it is, and make sense of it, or your visual memory, or your depth perception, right? It can affect these things even if your eyes still look straight. So there's a lot of things that can happen with your vision, even if it's not necessarily a strabismus. But if these things go on for long enough that only one eye is being used, the brain suppresses the other eye to make it easier to the brain is like shutting things down. Like, what can we shut down to make this easier to try to heal from this horrible thing that has happened? And if this eye gets ignored long enough, it could drift, right? We might have a drifting up or down. There might be a combination of a lot of different factors. But it's amazing to see when the brain, I think of a brain injury like when my kids play in the toy room and they like empty all the bins out. I like to be organized, so I like have labels on all the bins of what goes in each bin. Well, they dump it all out, and it's like they stir it. I'm like, ah. And that's, I feel like what happens, you've got like all these different centers of the brain. They're all in charge of different things. And when we're talking about vision, they all have jobs. And so you get this brain injury, and it's like someone just stirred it all. Everything got separated. And so you've kind of got this visual mess happening. And strabismus can definitely be a byproduct of that, because ignoring one eye can be a really good short-term solution for all the things that you may be feeling after a head injury. So there you have it. Yes, a traumatic brain injury can definitely cause strabismus, whether that's because something was damaged, like a nerve or a muscle, and those eyes can't actually physically move anymore, or if it was something where your visual system is not able to process and understand what's going on because of the brain is just in this like blah mode. And so it can result in an eye turning. There are solutions and things that can help so much, and it isn't necessarily the same. Like, I would never recommend virtual reality for someone who's had a traumatic brain injury, because they'll probably barf. So there are a little bit of a different approach, and I'll share that in the next video. So good luck, and we will see you then.